Hi, everybody. Welcome to a new episode of AI and Mental Health. Let's talk about it. Today, the topic is parenting and AI. I have a very special guest, at least for me. I hope that's a special guest for you too. His name is Dr. Guido Entenberg, and I have a personal anecdote to share before I let him talk. He graduated from University of Buenos Aires, where I also studied, so I knew him from many years ago. He worked at an institution in Argentina where I used to work too, Fundación Etsy. And when I migrated to US, at some point he came to me and said, "Hey, Eduardo, I need an advisor for my doctoral dissertation. I want to do an app for parents." I told him, "Why would you do an app if you can do a chatbot?" This was probably 2018. And that was the beginning of a very interesting career for him and a turning point in my career, because what we did, I think it was an amazing project, and definitely it sparkled all the chatbot research that I started focusing more and more after those studies that we did together. So Guido, thank you so much for being here. Thank you so much for the impact that you had in my own career. How are you?
Hi, Lalo. Thank you very much. It's really nice for me to be in here and being part of this interview. Yeah, I really, I really appreciate all the support that you have offered to me during my career. And before going and ask you about my PhD, my doctoral theme for my research, I asked you what should I do with my career. And and that moment you suggested me, okay, you should do the PhD. So it comes from before.
Okay.
So yeah, thank you so much, and yeah, really exciting about having this conversation today.
Super. Thank you so much. It's very nice to have you here. Let's go to the first question. Why would you care about parenting? What happened?
Well, so going backwards, I work as a therapist, as a child and adolescent psychotherapist, doing almost like 10 years, mostly working with parents, offering parent training or parenting interventions for children with disruptive behaviors or ADHD, different conditions or disorders. One of the things that I saw while working with parents is I saw different obstacles. On the one side, I was very aware and I studied like all the evidence-based treatments and interventions that we can offer for parents, for the children, but at the same time, I was seeing lots of barriers and obstacles for parents to receive these treatments. On the one side, you can see a bunch of parents each week, but you can't support every parent. You can get to every parent. So I think that maybe technology was a way to reach more parents. And at the same time, even though those that want to go to therapy, they face different obstacles, from money to pay for therapy, but also time. Parents are very busy. We learned that. We will talk about that, I think, during this interview, but we learned that we didn't need to learn that. Parents are very busy, always have different responsibilities. So I thought that maybe technology could be like a good way to, as we say, like bridge the gap and help parents receive these interventions.
That's a very good point. I did a very rough math one day that if you want to take your child to therapy by yourself, right, as a parent, it may take 6 hours out of the whole family, because it means one parent taking the child to therapy 1 hour, spending time there, and then coming back 3 hours, right? And then you need the other parent to take care of the other child. So that's a lot of time and efforts for the family, right?
Yeah, absolutely. And one more thing is that I think the characteristics of these parenting interventions, well, the name is parent training, so I think it was a feasible treatment and program to adapt to technology that maybe is different than some other treatments that are more, I don't know, like for like anxiety, like treatments that you do with the child, right, with the teenager, that you need like to reflect a lot. These interventions maybe are like less reflective and more about like teaching some specific skills. So I thought also like that is something that parents could benefit and that could fit well with this kind of technology possibilities, right?
That makes total sense. So treatment that is oriented more to teach a skill is very friendly for a chatbot versus a treatment that is more insight oriented, right? Okay, that's a good point. I think LLMs now may solve some of those difficulties, but I think it's still a valid perspective.
Yeah, absolutely. It's true. It's true that like, of course, like when we started, things were like absolutely different. Well, 2 years ago, things were totally different. But still, I would say that still I see that maybe teaching the skills, even though like with LLMs you can have like a more meaningful conversation. I still think that teaching skills is still more effective than like a very deep conversation with bots. That is possible, but a bit more challenging, of course.
That makes total sense. And speaking of teaching skills, let's go to the chatbot studies that we did, right? That you led. And this is something that I always say pediatricians may find this interesting, right? Because they see they are kind of in the first line of treatment sometimes. So let's start by introducing Mila, right? Let me put the name here. Oh, sorry. Okay. So what is Mila?
So Mila was a very, very brief intervention. First, it was 15 to 20 minutes, then was 10 minutes. It was an intervention that was teaching parents one of the very first things that we usually teach or address during parent training, that is how to increase your positive attention, but more specifically how to learn how to praise your child in an effective way. When we say to praise in an effective way, for example, it's about, for example, not mixing praise and criticism. Like if you tell your child like, oh, you did it great, but you should do it better next time, like you are not praising your child, you are criticizing your child. So those are the kind of things that we teach. So Mila was a bot hosted in Facebook Messenger that everyone had access to it. Like the approach was like, you can be like a parent, you were scrolling through Facebook, and at some point you face like Mira's page or some advertise. So then you click, you went like to Facebook Messenger, and you started like the conversation. So it was about teaching. There are lots of skills in teach how to praise that we teach in parent training, but we choose just like 5 or 6. And throughout the conversation, Mila was conversationally, of course, first like assessing the parents' knowledge, but then teaching like some of the skills that I was telling. Yeah.
Okay, and this was for parents of children ages 2 to 11, correct?
Yeah, 2 to 11 with no diagnostic or disorder diagnosed. So general population. It was a rule-based chat. Maybe that means that it was not that flexible. It was like we were talking about LLMs. It's not that if parents were trying like to talk about different things, Mina was a bit like, okay, let's go back to this. Like it was very straightforward. It was short, as I was saying, 10 minutes, 15 minutes. And the interesting thing about this is that it was the first one. Before this, there were no, like, there were just, at that point, this was 2016, 2015, like that was the moment, maybe 2017. There were like a few chatbots, maybe 2 or 3 that were like most famous, but not a lot. But for parents, there was nothing. So it was like the first attempt. That was what it was so short.
Let me clarify something about the years, right? For those that are in the field of technology, 2018, 2019 is history, right? In the field of psychology, studies take so long to be designed, to develop, and then the publishing process takes so much So that usually when you start a project, it takes 5 years to get published, right? So it takes a while. I think these studies were after the year 2018 for sure, because in 2017 was the first paper that we saw on chatbots,
Okay.
more specifically from Wobot. So probably 2018, 19, those years are the ones that we were talking about. But
1980, it must be like 18. I'm thinking when we started to design the intervention, but yeah, we should go and look to the specific day, but yeah, it can be, I would say 18 because 19, but yeah.
it's okay. It's okay.
It,
So
it,
let's go to the first study that you did. What did
yeah.
you?
The first study was a feasibility study. What we tried to do is our question was like, is this even possible to put it in those words? Like, is this something that parents would engage, or they would say no, this is impossible? Would this work? Like, we weren't sure that we could plan like the conversation and the rules, but we weren't sure like if parents were going to sustain like the whole intervention. So we planned something very short with a small sample, 33, 35 parents that did this. And what we saw, we obtained like really encouraging numbers. We had like a good completion rate, 78 completion rate. We saw that parents engage a lot in messaging with the bot. Like we had an average of 54 messages exchanged from the parents during the conversation. Yeah.
Let me stop you here. I want to highlight this. This was a very rudimentary chatbot, right? Having a completion rate of 80% of people that are simply scrolling online and finally suddenly find this ad and enroll in the study and take 20 minutes to complete an intervention. That is pretty good for what we're used to seeing in digital therapeutics. The completion rate alone is amazing. But what is really striking for me now, looking back, is parents send on average 54 messages to the bot. So I always, when I see these numbers, I ask people, who is the last person that you sent 54 messages? I can't think of, I don't know, my closest family probably got 54 messages from me in the last year, right? But that's a lot. For a chatbot study, this is, and in just one session, that for me, this alone means a lot.
Yeah, I would say that it's the amount of messages that someone usually sends in a meaningful conversation, right? Like when you are talking with someone about something deep or something meaningful or important, I think those are the kind of conversation that have like that amount of messages. Like if you're just like setting a plan or checking something, like you just exchange 1, 2, 3 messages. So that's something interesting that we discovered. We also discovered that parents were able to learn from this. Like at the end of the conversation of the intervention, we were asking, okay, like, can you tell me the names of the skills that you learn, of the things that you learn?
The 5 skills, right?
Of the 5 skills, and we saw that most parents like remember on average like 3.7 skills out of 5.
That's basically 80%.
Yeah, and 80%. And also that and when in the slide says like NPS, like the Net Promoter Score is like a very simple question, like would you recommend this to other people? And again, close to an 80% of parents says, yeah, I would recommend this to other people. So yeah, those and one last thing that we saw about the last point in the slide that was very interesting is that we did like a thematic analysis at the end. We saw like some frequent topics that parents were talking about. Like, let's imagine that at some point in the conversation, parents were saying, the bot asked, what is like a usual disruptive behavior in your child? So we saw that parents were talking about like very similar things. They were talking about habits, they were talking about emotional regulation, they were talking about disruptive
Sorry,
behavior.
similar things between them or similar things to what we see in therapy?
First, between them, we consolidated, okay, these are the 3-4 topics that like very frequent topics that they talk about. But that was the second point, is that we saw that these topics were very similar to the ones that me, for example, I was seeing in my practice. So I think that was pretty interesting, because even with the limitations and even being something really new, what we saw is that like that there was a chance of gathering through a chatbot, like gather information about what is happening at home between the parents and their children and in the family, and what are like the main concerns. If you want to be conservative, you could say, for example, that at least like for screening, we knew that it was useful, right? Like for screening and gather information about parents and their children, it was useful because the topics were very similar, the conversations were real, we were seeing that they were able to talk, so it was a pretty encouraging pilot study.
Okay, nice. Thank you. And then you did an improved version of this intervention, and you did a second study, and this was a randomized controlled trial with two conditions, one that received the intervention and the other one did not receive the intervention. So what did you find here for those that received the intervention?
Yeah, we were a bit more ambitious here. We said, okay, let's do like based on the first results, let's do this RCT. We did different analysis. One was, okay, this is the group that received the intervention. There was a group in waiting list, in wait list. What we saw, it was that the experience was overall pretty good. Like the numbers of we measure user experience, user experience in terms of acceptability, ease of use, interactivity, interaction, whether they were experiencing any technical problems. We had like, let's say like 5 or 6, I should check the article, but 5 or 6 things that we were measuring in terms of user experience, and the average scores were 4 out of 5, 4.5 out of 5, 5. So overall, like most of the parents that they talk with the bot in the RCT enjoy the experience, were satisfied with the experience. Again, we saw that they were learning, that they were remembering the things that we were teaching. So yeah, that was pretty nice to see. And again, we saw that the conversation was happening, right?
Now, let me ask you something here. You may know I'm a research-oriented person, right? So what matters most is, okay, did you find differences between the conditions, right? So here's the more juicy part. Did you?
Yeah. Short answer, no in terms of statistical significance, yes in terms of change. I mean, we did see that we ask parents like how often or how like how were they feeling in terms of self-efficacy or in the amount of disruptive behaviors that they usually see in the children before doing the intervention. We ask after the intervention, a couple of days after the intervention, like, okay, like you learn a few things, go and try them, and then tell me how do you feel. And we saw that there was a change in terms of like parents were reporting that they feel like an increased self-efficacy and a decrease in observed disruptive behaviors. The statistically the difference was not significant. We experienced a few technical obstacles during the intervention. Maybe now it's like it's fun, but in the middle of the intervention, Facebook changed the rules in terms of chatbots. So it's fun now. It's fun now, but they banned the possibility to follow up because it makes sense. They didn't want chatbots to troll people, but this particular chatbot was trying to help. But
Now,
I think that
in order not to blame Facebook, which I'm not interested in defending, by
no,
I'm
no,
neutral, right? But there's something that is interesting here, right? This is a micro intervention. For those that are familiar with the concept, it's like it's a very brief intervention. You probably heard of the work from Jessica Schleider. She has this single session interventions. This is even shorter than a single session, right? This is a 10 minutes intervention. So finding a significant difference, it is challenging, right? But the point is, if you have promising outcomes with one microintervention and you then add another microintervention, then maybe you will increase the chance of finding significant differences. So I think that this is like a very good first step and a promising first step. The fact that you do not find the significance is something that, of course, would require more research, but if it were that easy, we would all be doing it, right? So I think what is important here is that there's potential. Yes. So let's go a little bit forward, because from this study, you did another paper that's on the meaningful engagement. And what is this about?
Well, here what we try to understand it was specifically try to understand what was happening during the conversation and what kind of information we were seeing that the chatbot was able like to gather from parents and to learn from parents, and in basically whether if the chatbot was a good can do that role. For example, trying to understand the parents, trying to understand what are their assumptions, trying to understand what are the usual skills, the skills that they already have. So we call this kind of like meaningful engagement. But overall, I think that's what we were trying to know. For example, we learned that parents, we were like in the needs and greets, I think is of the conversation. And we learned that parents were telling the bot that they were very busy, very, very busy. So at some point, the bot was asking, okay, like imagine the situation, like usually you don't have a lot of time. So how can you like use that short time to share with your child? So most parents were saying, yes, I'm very busy. I don't have a lot of time to share with my
and this is
children.
something that 90% of the parents were saying.
Yeah.
Right?
Yeah.
Okay, so
Which,
this is something that is worth highlighting, right? You may think that going to therapy in person may be better. That's fine, but there's many people that actually cannot do it, and for those busy parents, this represents a very good alternative. So this is amazing. You also find that 96% provided relevant answers. What does that mean?
yeah, it means that when we were asking like this kind of like you sometimes mimetize with the bot, but when the bot was asking things like this, like are you busy? Do you have time? Usually, what kind of words do you use when you try to praise your child? People weren't telling something like I know, I don't know,
Blah
what
blah
do you
blah.
mean? Yeah, like okay, what do you care? Like they were responding to those kind of questions. Like for example, that's a good example. The bot at some point was asking like, what's your way to share to express praise or try to make your child feel better. We were sharing like lots of interesting things. So that's the kind of things that we were referring to provided relevant answers. They were really sharing with the bot the techniques that they use, and they were eager to learn from the bot new skills. That's or was our main conclusion. And again, as we were talking at the very first part, again, being very busy kind of build the case on the first hypothesis that this can be like a useful resource. Actually, like the study was in the middle of the pandemic, in the very first months, in the very first
Oh wow.
semester of the pandemic. So that makes totally sense. Like parents were at home with their kids, like this, and they weren't able like to go to therapy. So maybe at that time that was the case. I think it's still the case. Like parents still can benefit from
I
a
can tell
resource that
you, yes, we're
yeah.
still we're still
Yes.
right.
Yeah.
Okay, so Guido, thank you so much. I'd like you to share a little bit of what are your general thoughts about where we are at in terms of parenting and what you've done with your studies.
Well, I think we are in an interesting moment when we now, of course, now we have like more technology, better technology. We understand more about this, so the possibilities are huge, huge, right? We can do a lot of things. For sure, we know that parents are willing to have a conversation in that case with a chatbot, with a bot, with an agent, with a or engage with technology to learn new skills to improve their parenting. So I think that's my main conclusion. I think everything is to be done yet. Now we have like, as you were saying, we know that they can learn from an agent, from a bot. Now we know that they can chat and talk and engage in these kind of conversations. We have LLMs, so the possibilities are amazing. So yeah, I'm really excited of everything that will come in this field. I think we are still not not aware of how things can evolve, and probably on all the roles that AI can have in terms in improve children's lives and parents' lives. So yeah, that,
Guido,
that's kind
thank you so much. The last thing that you mentioned were LLMs, large language models. I promise for all of you that are listening and watching these videos, we will spend a lot of time talking about LLMs. And actually, what we're working at Parent AI is integrating LLMs for parents of children with behavioral problems, right? So what Guido studied in these studies is like something that kind of initiated this work that we're doing, and definitely using lots of the parent management training techniques that are evidence-based, that we know that they work. So we will have an instance in which we will do a demo. So if anyone is interested, subscribe to the bell that you have there or here, or I don't know where you have it, but you will see more the future of AI and mental health. This was a very interesting video, I think, to share a little bit of the context and the potential that we have. So future studies will definitely show what we're doing today. Guido, thank you so much again. I hope you enjoyed. Very nice meeting you again.
Thank you very much for the invitation, and yeah, best of luck.
Okay,
See you.
let's stop this.
Bye.